My name is Dr. Joshua Wert. I am a pain management physician with the St. Luke's Spine and Pain Associates of St. Luke's University Health Network. I went into pain management because my father suffered from chronic pain since I was very little, and I felt like it would be a nice legacy to leave my father if I could help patients that suffered like he did. My childhood was a great childhood. I grew up in Bethlehem. I graduated from Freedom High School. I grew up in a very blue-collar family. As a matter of fact, I was a roofer for 5 years before I went to medical school in order to help me pay my way through college and medical school as well. And learning the meaning of hard work from my parents as well as my personal experiences helped me to not only become the man and physician I am, but also helped me to identify and to connect with the patients that I treat, as many of my patients are blue-collar workers. The way I get to know my patients, at least for me, is by simply speaking to the patient, listening to their story, hearing them out, and figuring out where they're coming from, not only from a pain standpoint, but also from a point in their lives. A patient's story plays into how my treatment is going to be tailored to them, because each story tells me what that patient's individual needs are, not only from a physical standpoint, but possibly also from a social standpoint or even from a spiritual standpoint. So we will figure out where the patient needs help the most regarding, is it the physical pain, or is it actually getting back to work? And we focus our therapies and our treatments based upon that. Pain management has come a long way since the time that I was a child watching my father suffer through his ordeal to where I am now as a physician. We not only heavily rely on medications, but also on certain therapies as well as interventional techniques to improve our patients' pain and functionality. Those techniques include not only injections, but also neuromodulatory techniques such as spinal cord stimulation, dorsal root ganglion stimulation, as well as peripheral nerve stimulation, which has greatly improved our patients' functionality without having to heavily rely on medications. My promise is to provide the best possible care to my patients within my power by making sure that I'm collaborating with all of my colleagues that are involved in their care, as well as the adjuvant therapies, including physical therapists, occupational therapists, etc., to make sure that we improve not only their pain but also their functionality.